everyone. Pregnancies should be the same everywhere in the world, right? Well, they're definitely not the same in Kenya and Australia. There are almost 69 times more maternal death per 1,000 live births in Kenya compared to Australia. What a shocking number! How do these gigantic differences occur? The first thing that should catch your eye is that the bottom half of this timeline seems empty compared to the top half. The timeline represents the stages of prenatal care for pregnant women in Kenya and Australia. Australia is shown on top, and Kenya is shown on the bottom. Kenya is a country where only 21% of all the births are registered, so we can actually just talk about 1/5 of all pregnancies in Kenya. Basically, every number regarding Kenya can be taken times 5.
In Australia, a pregnant woman is advised to go to the doctor within the first 5 weeks. Her blood is tested for HIV, STIs, hepatitis B and C, and some other routine checks. If this test shows any abnormalities, an additional blood test is done before the 10th week to test for more serious diseases like sickle cell anemia and thalassemia. The first trimester screening occurs between weeks 9 and 13. The blood test checks for free BHCG and PAPPA concentrations because high differences shows possible chromosomal problems. The ultrasound scan is used to check for abnormalities of the embryo and measures the amount of nuchal translucency fluid, which if it's higher than usual, it's linked to Down syndrome. The first trimester screening shows any signs of possible problems. Either chorionic villus sampling or amniocentesis is carried out to find out more details about the genetic problems. Chorionic villus sampling consists of a biopsy of tissues from the chorionic area, while amniocentesis takes a small amount of the amniotic fluid, as it contains metabolic bioproducts of the fetus, fetal cells, and amniotic membrane. Both are invasive and both test for chromosomal and sex chromosomal abnormalities, such as Down syndrome, cystic fibrosis, sickle cell, and neural tube defects.
In Kenya, the antenatal care is not as structured or well planned as in Australia. In Kenya, pregnant women, according to the guidelines regarding obstetric and perinatal care, are advised to go to hospital for 4 visits. However, because of the conditions in Kenya, barely any women actually go to hospital 4 times before their labour. Therefore, every visit is seen as their last before the delivery of the baby. In Kenya, the first visit is recommended to be made before week 16. The mother's personal history is taken and she is physically examined. A blood and urine test are done, but the focus of the visit is mostly on giving advice to the mother. The blood is tested for HIV, STIs and other routine checks, and the urine test checks for diabetes, proteinuria and other routine checks. More than 50% of all Kenyan women don't deliver their baby at home. The differences are due to the lack of educated staff in Kenya. Most of the hospital staff are skilled attendants. This could be due to the fact that there are a limited number of universities offering a medical course, but also because families can't actually afford the university fees. A quarter of facilities do not even provide any prenatal care.
In Australia, a routine structural ultrasound is performed between 18 and 20 weeks. The doctors check for structural abnormalities of the baby, the growth of the baby, the development and positioning of the placenta, and the amount of amniotic fluid. Between week 24 and 28, a gestational glucose test is done, which checks the blood glucose levels of the mother to make sure she does not develop type 2 diabetes. If the glucose test levels are too high, a glucose tolerance test is advised.
The 3 following visits are supposed to happen before week 28, 32 and 40. The main goal for the visits in Kenya is to educate the mother on nutrition, lifestyle and behaviour, and to prepare her for the upcoming birth. Also, in Kenyan hospitals, the health of the mother is prioritised, focusing mainly on HIV and AIDS prevention rather than the health of the baby.
This is due to the fact that Kenya is placed 4th on World AIDS ranking, whereas Australia is only 77th. In Kenya, advice and preparation is the main focus of prenatal care because the population is less educated compared to Australia. All these above-mentioned reasons lead to 33,000 stillbirths a year in Kenya, which is 15 times greater than in Australia. I want to thank you all for watching, and keep in mind, don't get pregnant in Kenya.